Good morning, all of you. In the last video, I explained you about the anterior triangle of the neck. So in this video, I'm going to explain about the posterior triangle of the neck. So posterior triangle of the neck is located at the posterior lateral aspect of neck. That means posterior part में और हल्का सा lateral part में हमारा posterior triangle present होता है. So posterior triangle of the neck contains borders, contents and clinical correlations. So let's come to the border first. Same as the anterior triangle of the neck, this also contains the borders. So the first border, the posterior triangle of the neck is situated posterior lateral aspect of the neck, and anteriorly it get bounded by posterior border of sternocleidomastoid muscle. Posterior border of sternocleidomastoid muscle. Then same posterior triangle of the neck is posteriorly bounded by anterior border of trapezius muscle. Then inferiorly it get bounded by middle 1/3 of clavicle bone. Now let's see the picture. So this is the posterior lateral triangle. This black dot is the covering of the posterior lateral triangle. So as you can see in front of this triangle, this is the SCM, and this posterior part of the SCM is bounded the anterior part of the triangle. So on the behind, this is the trapezius muscle, as you can see. So anterior part of the trapezius muscle bounded the posterior part of the triangle. Inferiorly, this is the clavicle bone. So its 1/3 of middle part is covered the inferiorly triangle of the neck, posterior triangle of the neck. Now let's come to the roof. Roof is formed by the investing fascia, and floor is formed by the prevertebral fascia. Now what is prevertebral fascia? Prevertebral fascia is the deep layer of the cervical fascia that also surrounds the vertebral column. That's all about the borders. Now let's come to the contents. Contents, it has muscle, vasculature, that are veins, arteries, nerves. So let's come to the muscle. The only muscle that signifies the posterior triangle of the neck. Suppose this is the, as you can see in the picture, this is the posterior triangle, right? So anteriorly bounded by posterior part of the sternocleidomastoid muscle, posteriorly bounded by trapezius, and inferiorly the 1/3 of clavicle. So omohyoid muscle comes like this and enters into this. So only muscle that signifies the posterior triangle is omohyoid muscle. So this is the superior belly of omohyoid muscle, and this is the inferior belly of omohyoid muscle. So inferior belly, travels superior and medial direction and splits the triangle into two parts. Here is the one triangle that splits by the omohyoid muscle, inferior belly. Here is the second triangle. So inferior belly of the omohyoid muscle divides the triangle or splits the triangle into two parts. Now let's come to the vasculature. Vasculature means the vein involved in this triangle. So the first and very common vein is external jugular vein. Next is the subclavian vein. Third is the transverse cervical vein. Suprascapular vein. So these are the veins that involves in the posterior triangle. Now let's come to the arteries. So arteries, the first is the occipital artery. Superficial cervical artery. First nerve is accessory nerve, that is cranial nerve, 11th. Second is phrenic nerve. Third is cervical plexus or brachial plexus. Now let's come to the subdivisions. Subdivision means division of the posterior triangle of the neck. So as you know, omohyoid muscle is the main muscle that divides the triangle into two. So the first triangle is the occipital triangle. The second one is subclavian triangle. Now let's come again on the diagram. This is the inferior belly of the omohyoid muscle that divides the major triangle into another two. So the upper triangle, the superior triangle, is known as the occipital, and the inferior triangle is known as the subclavian triangle. So superior to omohyoid muscle is known as the occipital. Inferior to omohyoid muscle is known as the subclavian. Now let's come on the last, clinical correlation. So clinical correlation is this: when we talk about the cervical plexus, that is the nerve involved in the posterior triangle. So the clinical correlation of this is in the major of the head surgeries, the cervical plexus get blocked by anesthesia. This is the main point where all the nerves get anesthesia to perform the surgery. As you can see in the picture, this is the meeting point of the several nerves that get anesthesia so that the surgery can be performed. So this is the clinical correlation. I hope you liked the video. Thank you.